Hi, Doc. Dr. Tim Maggs here. I want to start out today. I have two things I want to tell you. Both of them I think are critically important, to me anyways. On November 1st and 2nd, Dr. Jerome Rerucka and I are going to be holding the third seminar in the series of three that we had, and it's going to be in Baltimore, Maryland, 12-hour CEU. Now, I can tell you that what you will get out of it is you'll get advanced information because I've got my many published research studies, which is information you'll be able to take back to the office Monday morning to provide much more concrete evidence to patients why they need you. Okay, and we're going to go over a variety of things. Dr. Rerucka has new technology that he's introducing to the profession. It's very exciting. So you certainly would get your money's worth if you decide to come, and if we can get you to come here. We're very excited for it. If you go to drtimmaggs.com, that will get you the ability to sign up and to join us for that very exciting weekend. We will go over the structural fingerprint exam, which again to date is still the only full biomechanical exam available in the country today. So we have docs across the country using it. It is so appropriate for industry or sports or for the general population. So again, come and get reminded as to the details of that and grow into where the future is. Don't live in the past. You know, there's a lot of things in our profession that live in the past, live with BJ and all of the, the icons of yesterday. Yes, but the technology is advanced, and musculoskeletal is an industry that doesn't really have a system or a protocol. And we want to establish that, especially as chiropractors. We are the perfect ones to become the experts and the go-to in the profession. We're also going to go over our new guest, which is Actuary Alex. In this imbalanced biomechanical graphic, it kind of says it. Every human is imbalanced, and we'll go over how to test for it, how to categorize it, and how to communicate it to the patient. However, there is a cost attached to every human being. And before that person dies, they will pay some enormous cost. And it can be money, it can be disability, it can be pain and suffering. They will pay an enormous cost. What we do today can help them to dramatically reduce that cost. So every patient in your community, every person in your community is a candidate to be a patient with or without symptoms if you learn how to communicate that message, get them into your office, examine them, communicate that report to them. They should want to be a patient for life. So we're going to go over a lot of that at the seminar. Now, to bring real life to you, last week I had a patient come in, and it is a tremendous case, and it supports everything I've been saying for the last 25 years since I started traveling the country lecturing. So we had a 20-year-old female came in with severe low back pain of 2+ weeks. Now, every one of us would handle it differently, and my concern is that the majority of us would start a treatment program without imaging. And I go back to the early 2000s, and I have published articles on the importance of imaging. And you have to image to know why that pain is there. I'm hypersensitive to teens or young 20s with severe low back pain. So I'm going to do the most of the imaging that can be done to rule out any severe injuries. So let me explain how this one unfolded. We performed the structural fingerprint exam on this patient, and that meant there's a series of tests we put this patient through. The most important tests are the imaging. So here we look at this young patient, 20 years old, and she has 14.2 millimeter femoral head height difference while no shoes on standing. Well, after literally doing thousands of APLS x-rays, I can tell you 14.2 millimeters is enormous. And then you have the Dr. Maggs law of tissue tolerance. When the loading of a tissue exceeds its capacity, it starts to break down. So with this asymmetry in this patient, with this imbalance in weight distribution, former tennis player, The second law of life that we attribute to this is that the body keeps a perfect scorecard of every banana peel you ever stepped on. So the loading that has gone through this body accumulates, and then in the end, the straw that breaks the camel's back is a true phenomenon. On the lateral view, her Ferguson center of gravity line looks pretty good. Her sacral base angle is a little shallow, but it's not real informative. So as we do, we know that every patient has collapse of the feet. We have the research to prove it. We will go over that research and allow you to use that in your office. So we're going to start at the feet. So we put orthotics on the patient, put in the patient's shoes, and we take the x-ray, and it goes from 14.2 to 11.6. Okay, that's better. Now we'll put a 7 millimeter lift under the left orthotic, and that should get it better. I've had to learn how to become happy with better and not perfect, but we have had tremendous results when you make it better. And as I tell the patient what we're doing, we want to put your pelvis and your body weight distribution into an optimal state. So whatever injury is there, we can heal it quicker. So now what I did, having been through this many times, 20-year-old with her father, I said, listen, I want an MRI immediately. Now, the insurance companies don't want you even thinking of an MRI for 6 weeks. The public is unaware of the value of MRI. The medics, they do an MRI if they think surgery is needed. But there's 2 conditions I'm very concerned with: a disc injury, number 1, and number 2, some version of spondylolisthesis where there's bone marrow edema in L4 or L5. Both of those are critical injuries that need very specific treatment, and the treatment protocols for both are dramatically different. So we ordered an MRI, and what we got back, if you go down on the left page to L5S1, a large posterior disc extrusion, lateralizing slightly to the left with approximately 10 millimeters inferior extension, producing severe stenosis of the central spinal canal, and moderate to severe left and moderate right lateral recess stenosis. Now, in a 20-year-old patient, you cannot think that this is okay. Okay, so how many offices would she have gone into that would not have seen the 14 millimeter difference, that would not have done the MRI, would not have put orthotics on, would not have put a lift on, would not have known she's got an extrusion? How many adjustments would she go through? How many PT sessions would she have gone through? I mean, we have to step up. We have to. And if our goal is to become the go-to providers, then we have to use imaging. Here we can see we've immediately got her on laser treatment, and we've got her on spinal decompression, because in a condition like this, you always want to go through conservative care before you ever recommend her to the surgeon. All right. So we've had much success with this case with this younger population. In the end, if a patient doesn't respond, I would say after maybe 20 visits, I would give 10 visits, and then when I do a second 10 visits, not responding, I would refer them with their x-rays and their MRI to an orthopedic surgeon for an evaluation, but not until we've gone through the conservative approach, because this approach has helped probably 98% of the patients that I've had that have had this condition. So in the end, your protocols are critical. You're the go-to. You're the one in charge. You're the one that can do the testing that needs to be done. You don't want to be apprehensive. So I'm going to go back to, we want to image every patient, because without that x-ray, I would not have known of her femoral head height difference. Her father said to me, how? She's only 20 years old. And I said, just imagine the difference in the wear on that disc due to that femoral head height difference, the grinding of that disc, and the tissue can't take it. So because X-ray and MRI combined gives you about 100% information on that patient, you want to have it available to you. Now, in this particular case, we sent her to the MRI facility that charges out of pocket $350, because her insurance requires 6 weeks of treatment before she can get that MRI. So it worked out beautifully. Within 4 days, we had all this information and had her undergoing treatment. So now her only comment to this point is that the orthotics and the lift made an immediate difference in the pain. So that's what we want to go after. So docs, please join us in Baltimore, Dr. Jerome and I, and let's kind of all work together. A pack of cyclists goes a lot faster, a lot further than one cyclist. So let's kind of get together as a pack and let's start looking down the road and let's recognize how much value we could bring to our community. And then let's go to Baltimore, kind of huddle up, break the huddle, go back to our communities, and just have an awesome time and help more people. All right. Thanks much, Doc. In the end, it's drtimmaggs.com. That'll get you to the point where you can register for the seminar, and we're looking forward to seeing you there. Have a great day.